Well, hi everyone. My name is Dr. Jeff Schroeder, and I am going to be the instructor for your upcoming course, NU602 Evidence-Based Practice. Most of you, probably all of you, have recently come off of your NU601 course, which is your nursing research course, and this course is designed to follow what you've already learned in nursing research. Evidence-based practice in many ways is taking those things that you learned in nursing research and applying them in a real world setting. You will not be actually doing any research in this class. Evidence-based practice is not really nursing research per se, but what it is it's taking research that has already been done, using it to identify and implement new practice, and then to study that practice or to monitor that practice to see if those planned interventions have been effective. And so this course is going to flow pretty narrowly. Where in nursing research we tend to talk about a lot of different topics and a lot of different issues. This one is going to be pretty much evidence-based practice all the way straight through. Each week I will be posting one of these videos, or at least most weeks I will. The videos are not meant to be so much instructional in nature. In other words, I'm not going to be coming in and doing any teaching per se, but they're more just a little introduction to the week's content, a little wrap-up about the previous week's discussion, and they'll be done in real time, meaning that I'll actually be giving feedback on the discussions that have actually occurred in class, addressing any issues that have come up or anything that sounds like it might need some clarification or amplification. In other words, these aren't just pre-canned videos that I do and post in every class. They're different for each class and specific to the learning that goes on in this particular class. Just a few notes for this first week. Mostly what I'll be doing in class is just getting to know you, so please make sure that you go into the discussion board. Each of you has taken online courses now, or at least I'm assuming that everybody has had online courses, and so you pretty much know how to navigate Blackboard, and you pretty much know how these things run. This course is really not too terribly different than the previous courses that you've been in. You'll be responding to discussion questions each week, or at least most weeks. Discussion question responses are generally due by Wednesday. Your initial response to a discussion question. Follow-up responses due by Saturday night. And that's pretty much the structure through the entire class. That's probably pretty much what you become used to. I do follow the rubrics pretty closely, so for each of the assignments in the course, you will see that there is a rubric attached. I recommend that you review the rubric. Don't just look at the assignment description. Also review the rubric. The rubric oftentimes goes into more detail about some of the more specific issues of grading, so just know that I do follow those rubrics pretty closely, and if you stick to the rubric, you should do just fine. For week number one, besides just getting introduced in class and getting oriented a little bit, you'll be posting your introduction, and I'll get to know a little bit about you that way. You also have your first discussion question, and this is where we start this discussion of evidence-based practice. All evidence-based practice starts with the identification of a problem. Just like in nursing research, there's no sense doing research on something if you don't have a problem to address. If there's no problem, probably no reason to go and research it. Evidence-based practice is really the same way. If your practice is up to date and if everything is moving forward fine, you don't have any issues, then there probably isn't any reason to implement anything new or implement any new procedures. However, healthcare is a very dynamic field, and we're always changing. We're always coming up with new protocols, new things are being identified, new science is used, and so change in practice is a constant and it's just a constant in what we do. And so this first week we're going to be talking about identifying a specific problem in nursing, and then identifying this thing called a PICO, and identifying a PICO question. A PICO stands for it's an acronym. It stands for the patients and or population, the intervention, a comparison intervention or comparison treatment, the specific outcomes that you expect that will occur due to that new intervention, and then the time frame. Now, as you read through the textbook, it will give you different ideas and kind of sort of different variations on the PICO. For the purposes of this class, I want you to stick with that straight PICO question. In other words, I want you to identify a timeline or a time frame of how much time you will give before you determine if your intervention was effective or not. And think of, a specific intervention and then a comparison. Now, this will become a little bit clearer as we work through the class, but one of the things to keep in mind is that when you're developing a PICO, remember, when we talk about evidence-based practice, we're not just talking about what is the best intervention for a particular patient. We should be looking at a patient population here. So your PICO should not read like a care plan, where you come up with an intervention and then a specific outcome for a patient. For example, an example of a very simple outcome or example of a PICO might be, for example, you've identified that you have a hospital that has a high rate of hospital-acquired infections. And so in talking to staff or observing staff, you recognize that they are not washing their hands properly. They're not following the standard CDC protocols of washing for 30 seconds and washing before and entering into patients' rooms. Maybe they're not using alcohol gel in and out. Anyway, you identify that there's some lack of knowledge, something lacking in practice. So a PICO might be that for patients in a medical surgical unit or in a hospital, does an intervention such as a new training procedure for nurse hand washing or a new policy or something different, something new, and that should be specific. What are you going to actually implement? Is that new intervention that you choose, when compared with and something to compare it with, usually that's going to be your current practice. Maybe the hospital doesn't do any special training in monitoring hand washing, or they haven't put up any educational materials or something like that. So that would be the comparison. So you'd be comparing a new hand washing education program compared with no specialized training. Does that result in a specific outcome? In this particular case, decrease in hospital-acquired infections when tracked over a specific time frame. Something like that is usually 3 to 6 months. So that's an example, a very simple example of a PICO, but that's kind of how a PICO question should read. But really, it's up to you. This is I suggest that you pick a problem, pick something that you're interested about, maybe something that you might want to implement in your facilities, because this is going to be the problem and the PICO that you're going to be working on really in virtually every assignment of this class, or at least everything related to evidence-based practice in this class. So I'll leave you to the reading, and I will leave you to the course materials to learn a little bit more about that, but that's what we're going to be doing in week number 1. Also, I have posted an announcement for week number 2. In week number 2, you have an assignment due that's going to be an experiential paper, which in this class is a interview with a librarian. Most students like to contact the Sacred Heart University Library and talk with their librarian there, especially if you're in Connecticut or if you're in the greater, close to the school. That's probably a really good option. If you're working, however, in a large medical center or close to another school, or if you've gone to school in another college or university that you know a librarian that also has a very good library system, that's another option too. You can contact them. You don't necessarily have to use the Sacred Heart librarian, although he is a very good resource. His name is Jeff, just like mine. His name is Jeffrey, and so he and I get confused quite a bit. And he's actually a very good contact. And you'll find that a librarian, when you're doing any form of nursing research, particularly when it comes to evidence-based practice, your librarian is your best friend. They are the experts when it's come to locating information. You'll be needing to locate and find peer review information. So if you're not up to speed with using the databases and the school library, you'll want some experience with that. You'll want to review on how to conduct a a good keyword search, because we're going to be talking about that in the upcoming weeks. But I do have information on contacting the librarian here, so you want to have that on your radar screen. That paper will be due the end of next week, but it's something that you really want to start to schedule soon. So with that, I will leave you to it. I will look forward to seeing you in class, look forward to being your instructor on this leg of the your nursing program. You can go ahead and review my information and my little brief bio. I am on the West Coast. Actually, I live most of the time down in Rosarita Beach, Mexico. I kind of split my time between Rosarita Beach and a home there, and working and living in primarily in the San Diego area, and also in the Inland Empire area of Southern California. If you don't know where that is, I have a house about 60 miles east of Los Angeles, between Los Angeles and Palm Springs, and then, but actually work down in the San Diego area primarily. I kind of do some consulting and do things kind of in a lot of different ways. And so I kind of get around a bit down here in the Southern California area. But I am on the West Coast though, so realize that when I'm participating in class, it's usually going to be early in the morning, usually late in the afternoon. And so if you post me something in the middle of the day, I likely won't see it until later in the day. I do have my contact information posted though. If you need to contact me, if you do, email is by far the best way. It's my preferred way. But I do have my cell phone listed also, and have information in the instructor contact area how to get a hold of me. So I've blathered on long enough. I hope that you all have a good week. I'm looking forward to a great class. If you have any questions, let me know, and I'll see you in the discussion forums.